She got the sun and Jupiter.
Lori Simonelli has waited 14 months for this moment, a chance to be outside with her mother Carol, listening to Frank Sinatra.
Hold my hand.
Simonelli moved her mom into Chestnut Ridge 2 years ago.
They had bingo, they had games, they had a beauty parlor.
You felt good about her being there?
Yes. And then it stopped.
What changed?
Everything.
Everything means COVID, temporary staff, and isolation. Her mom is wheelchair-bound and has dementia. There are days Simonelli has wondered whose clothes her mom is wearing, why her water isn't placed within reach, or how illnesses like a UTI can go undiagnosed by those on the inside.
She misses church. She misses hugs. Sad.
That's why every day Simonelli studied this report, which lists the COVID cases at nursing homes throughout the state. In November, Chestnut Ridge reported its first positive resident.
All of a sudden, a week later, they have full patient involvement, full staff involvement. And then...
So you knew in your gut
that there was infection practices that possibly were not being observed.
According to the state, it actually took about 3 weeks. But yes, by December, just about every resident had tested positive, and staff were quick to follow.
The nursing homes have kept...
Brian Lee, director of Families for Better Care, says there's usually one key reason why.
The underlying cause is the lack of staff. Georgia staffing levels are horrible, tragic, okay, on so many levels. There needs to be something done to help improve staffing.
Georgia did try to do something. It used tax dollars to foot the $450,000 bill to hire temporary nurses at Chestnut Ridge. Throughout the state, we have spent more than $378 million at hospitals and long-term care facilities during this pandemic. Still, it was Simonelli, a retired patient care technician, that noticed her mother struggling to breathe during a window visit.
She's labored. She's like this. It's obvious.
The facility gave her mom oxygen, but as Carol's condition grew worse, the family demanded they call an ambulance. At the hospital, doctors told them
she has COVID pneumonia in all lobes.
What's baffling to Simonelli is that just 1 month prior to the outbreak, Chestnut Ridge had received nearly $119,000 from the federal government, bonus money for doing a good job protecting residents from the virus.
Yeah, it's very alarming. It's just alarming.
Last year, the U.S. Department of Health and Human Services gave more than $45 million in bonus money to 321 nursing homes in Georgia, even though 42 of them had received fines for safety violations that same year from the same federal agency.
What this pandemic has done is it's exposed the cracks within the long-term care system, the staffing issues, the oversight of the nursing homes, the lax oversight.
Some of the fines related directly to infection control, rooms not properly disinfected, staff going in and out without washing their hands or wearing face masks. According to this inspection report, a nurse at Herdmont Health and Resources tested positive for COVID, but kept working for 5 days in direct contact with at least 40 residents and staff. And in almost every case, the bonus money paid for those fines and then some.
They got all their fines back and then some in bonus payments. Is just a total disservice, slap in the face, gut punch, whatever euphemism you want to use, to the residents who have already suffered so much of this pandemic. It's just a total injustice for them.
More than half of the facilities earning this bonus payment have had 5 or more residents die from COVID. But HHS defends the payment, saying in part, nursing homes have been disproportionately impacted by this pandemic, given their congregate nature and increased challenges of controlling infections.
This is very upsetting. Can you believe that?
Until now, Simonelli has had to advocate for her mother from a distance, a window always between them. That's why she gets upset when the blinds to that window are closed.
It's what time? 11 o'clock. And there's no, look at, they're all like locked in and no sunshine. So that's the way it goes.
Inspectors found no problems with infection control at Chestnut Ridge when they visited in July, August, November, and January. Still, COVID killed 10 residents there. As for Carol, investigators went out more than a month after her daughter filed the complaint. They ruled her claims unsubstantiated.
Look at the sky.
I know, it's beautiful.
Still, Simonelli is keeping a watchful eye over her mother's care. She hopes things return to the way they were.
Nothing but blue skies. Do I see?
Nothing but blue skies from now on.
Bluebird.